On September 4th, the Washington State Department of Health issued a standing order, which is a directive to issue COVID-19 vaccinations to anyone over the age of 6 months. There is no prescription necessary, no parental consent, and many of these vaccinations will be off label. Providers can now issue vaccines outside of the FDA approved age range based solely on their own discretion. This is a live standing order. It was issued very quietly. And in today's video, I'm going to connect the dots for you. I'm going to take you down in the rabbit hole with me. We're going to take a look at a bill that was passed this year in Washington State that gives the state unprecedented authority to make medical and health mandates, as well as connecting this to the West Coast Health Alliance and some other things that are law in Washington State that citizens, especially parents, need to know about. Hey everyone, I'm Julie Barrett, founder of Conservative Ladies of America. And in today's video, I'm going to connect the dots for you again on this crazy news that's coming out of Washington State. On Thursday, the Department of Health quietly issued a standing order. And I want to give a huge shout out to Mary Long, who is on our leadership team. And she is our Washington State Board of Health, Department of Health watchdog. She watches all of these things very closely. She attends all of the meetings and often makes public comments. And the vaccines are something that she cares very deeply about. And as someone who had a career in the medical field, she's very knowledgeable about it as well. And so last night she tipped us off to this and she said to our whole team, she's like, hey, you guys, do you think that this standing order is something that we need to take a look at? And as soon as I looked at the document, my jaw dropped, but it wasn't unexpected as we predicted with the bill that passed through the legislature this year. Then you saw the West Coast Health Alliance on Wednesday. This is the next step in the framework that they're creating to make a mandate. Now, we've put out a lot of material on our website and on our social networks, and a lot of people are saying, well, this isn't a mandate. We didn't say it was a mandate. We said it's a standing order. This is a framework for a mandate. So I want to walk you through all of these steps so that you can see where this is heading. So let's look at the timeline. In February, House Bill 1531 was filed in the state legislature. This bill allows the state to have unprecedented power to enforce any kind of medical or health mandates statewide. So it takes away from the local jurisdictions and it gives the state the power to enforce these mandates across the state in public schools, also in private schools, which we're going to get into in a minute. So where during COVID, you had sort of a patchwork between counties, you won't have that going forward. Everything will be top down from Olympia statewide. House Bill 1531 made its way quickly through the legislature and was passed by both chambers, the House and the Senate, in April. And on April 21st, Bob Ferguson signed it into law with an emergency clause. And what that means is the bill takes effect upon signing. Most bills usually have like 90 days or they're effective on July 1st or September 1st. But this bill took effect on April 21st. And I've already done a couple of videos on this. So if you want to deep dive on what House Bill 1531 is, go and take a look at those videos, which I will have linked in the description. Then on September 3rd, the West Coast Health Alliance was announced. This is where you have Oregon, Washington, and California joining forces to defy the Trump administration and the changes that are happening at the CDC and, of course, RFK Jr. at HHS. They want their decisions to be based on the science. This is not surprising. It was very much to be expected. I did a deep dive on this video a couple of days ago, and I'll have that video linked in the description as well if you want to go check that out. Now, this standing order was quietly issued on Thursday, September 4th, the day after the West Coast Health Alliance was announced. These things are starting to ramp up very quickly, especially with a new school year starting in Washington State. This is something that parents and citizens need to be alert to. We have shared this information on our social media platforms since we found out last night. It's also gone out on our Substack and on our website. And some people are reading it and they're saying, well, this isn't a mandate. No, we didn't say it was a mandate. It's a standing order and it's a framework for a mandate. So, what that means is they are setting the stage, they're setting all the pieces together so that they can push through a mandate, so that they can have vaccine passport mandates, so that they can have you required to get a vaccine to be able to go to work or to go to school or to go to a public place, such as they did in King County in, I think, 2021, I think it was, where they had the vaccine passport. You couldn't go into a restaurant in King County if you didn't have the passport. That's what they're headed to here. They're not there yet. There's no mandate as of today, September 6th, 2025. This is where they're going, and they're going there very quickly. So what's important for citizens is to take in all this information that I'm going to give you, and I've got lots of links in the description as well. You need to prepare, and you need to make a plan to protect yourself and to protect your family. Let's take a look at what this standing order does. It authorizes vaccination of all individuals aged 6 months or older. That includes pregnant women and off-label vaccine use. It relies on provider discretion, not parental consent, and there are no opt-out provisions, no requirements for informed consent. These decisions are made based on reasonable medical judgment and guidance from professional associations. Now, we have seen several of these professional associations push out information about vaccines that goes against the new guidelines at the CDC that are coming out of HHS. So these are the associations that Washington State is going to be relying on for their COVID information. Now, I mentioned that this could be done without parental consent. So I want to explain to you about Washington's mature minor doctrine. A lot of people aren't aware of this. Some people always comment, oh, is this something Ferguson did, the Washington Democrats? Well, no, actually, this goes back to a 1967 court case. And so it's been the law in Washington State for decades now. And I learned about this in 2021 when my 14-year-old daughter was at Seattle Children's Hospital, and they were able to allow her to make decisions without my consent. And that's originally what sent me down the rabbit hole on all of this legislation to begin with. And it's why I'm so passionate about telling other parents what is going on. So what this mature minor doctrine means is that your child can consent to a vaccination if the provider determines that your child is mature enough to make that decision. So in a state like Washington, where a lot of the doctors or nurses or the people giving these vaccinations are probably kind of woke, they are going to be saying that an 8-year-old seemed mature enough to make the decision to get a COVID vaccination. This is something parents need to be very alerted on, and you need to tell other people. A lot of parents, even still today, I feel like I've been shouting from the rooftops for the last 4 years, and so many people still don't know, or they'll say, over my dead body. Well, you know what? You send your kid off to school, or you send your kid into the doctor's office, and you don't go with them, and they are influenced by these adults. We teach our kids to, respect authority, respect adults. And these are conversations that you need to have with your child. Now, let's rewind to last spring during the legislative session and House Bill 1531. This is really the legal backbone for this vaccine mandate that they are very quickly advancing towards. It makes vaccine promotion a state priority, and it voids any local law that goes against the state directives. It also blocks school boards and counties from resisting mandates. So the connection here is that House Bill 1531 is the law that makes this standing order enforceable statewide. Another comment that I hear often from parents of private school children is that their children are exempt because they go to a private school. And my friend Stephen Welliver on X reminded me this morning that in 2022, Washington's State Board of Education passed a rule that made it so private schools were not exempt from any kind of vaccine mandates. Under Chapter 180-90 of the Washington Administrative Code, private schools are now subject to the very same health mandates, and they risk losing state approval if they don't comply. That means all of these vaccine orders, including off-label COVID-19 vaccinations, will apply to private school children as well as public K-12 students. There are no protections for private and faith-based schools in Washington state anymore. I wanted to show you also some of the other states that are breaking from the Trump administration as it pertains to COVID-19 vaccines. As I mentioned, we've got the West Coast Health Alliance which Hawaii joined on Thursday. Massachusetts also just announced state-led vaccine coverage. New Mexico has issued an emergency public health order to preserve access to COVID vaccinations at pharmacies, countering federal restrictions. This order allows pharmacists to vaccinate broader populations without prescriptions, ensuring availability for healthy adults and children. And Illinois also issued an independent advisory and bulk vaccine purchasing. They're using their state vaccine advisory committee, and they're considering direct bulk purchases from manufacturers, completely circumventing the federal government. Illinois also says that the CDC is no longer credible. Colorado and Pennsylvania have also both expanded pharmacy access to COVID-19 vaccines, allowing providers broader access to give these vaccines to people who may not be on the CDC recommended list. And the only outlier we have right now is Florida, who is going in the opposite direction. Governor Ron DeSantis on September 3rd announced a new MAHA commission, which will be run by First Lady Casey DeSantis and Lieutenant Governor Jay Collins, and also announced an end to all vaccine mandates statewide. What we're seeing in these blue states is going to continue to get worse. They're going to continue to double down on their following the science, and citizens need to be prepared. Rather than fighting back because you can make all the noise that you want, I would encourage citizens to prepare their families, prepare their children, prepare your property, prepare your home. I have done a video on emergency preparedness and how to prepare yourself for, another COVID emergency or even a natural disaster type of emergency. I'm going to link that video up in the description as well, because I think emergency preparedness is one of those things that many people don't really think about that much. And right now, if you are in a blue state, even if you're in a red state, you really do need to think about being prepared. I'm talking about food supply and, not relying on the government, having a stockpile of ivermectin and some of these medications so that you can treat yourself and your family and you don't have to rely on woke doctors. This is something that we have seen on the horizon in Washington state for a long, long time. When I first got involved in 2021, we were seeing them ramp up policies to set the state up in a good position for the state, that is, to be able to roll out these mandates and have emergency powers and controls over the citizens for the next emergency. And here we are, you can see them really stepping on the gas with this. So I would really encourage citizens to be on high alert and start planning and start being prepared. Again, I'm going to link a bunch of information for you in the description of this video. Please do go read through that. I've also got all of the documents that I discussed in today's video. Please be sure to share this video far and wide so that other people can understand what is going on, what these laws are, how they all work together so that they can take matters into their own hands to protect themselves and their families. Thanks so much for watching, and I'll see you in the next video.